There you go. Now, am I able to see like chat and all that stuff? I need to get another computer here set up. Should I admit? Participants here. Hi, Cheryl.
So we're just slowly letting everyone in. We have about 5 minutes till we'll get started. If anyone has questions, you can always start asking now.
Who's going to monitor the chat box for me? Should we get another computer set up here? And keep it here.
Hello, everyone. Welcome to our MicroTox training. We're just letting everyone in, so just bear with us. But as we get started, if you guys have any questions, go ahead and use the chat box, ask away. Now is the time.
See, most people it's what, 6:30 right now at night? Probably been a long day, so thank you for logging in. Hi. We're waiting for a few more. Here we go. We've got 4 more coming on.
You guys could do us a favor and change your name on Zoom. I don't know if you know how to do that, but some of you guys it just says owner. So if you could maybe enter your name into the chat box, just so we know that you have entered the room and we know we can start our class on time. That would be super helpful. Thank you, everybody. Perfect.
I think mine says Zanetta Pabon already.
Perfect. Looks like you guys
I think,
fixed it.
yeah, everybody's set up now with a name, so that's great. Thank you. You guys are, Lindy's here. You guys, oh, I love that you have your videos on. Looks great. I don't need to see too much. I love that I can see familiar faces and names. Where's everybody from? You can either type it in the chat box or you can unmute and tell us where you're at.
New Jersey.
Jersey, awesome.
Maryland. Miami.
Miami, lots of people from Miami, I think.
Wyoming.
Oh, Wyoming, very good. Maryland too, awesome. Also Wyoming.
Wow. Well, thank you for joining us. We're so excited to have you here. If you guys have any questions, hi, I'm Lauren. I'm the one you guys been emailing with this whole time. So you can put a face to the email now, but
Lauren
we're
and
excited
company.
but we're very
nice.
excited. Thank you. We're excited for you guys to get started in the MicroTox class. Leslie will be lecturing for maybe about 30 minutes or so, and then she'll get started with a couple models to show you guys some hands-on. So if there's any specific questions you have, feel free to enter it in the chat, or you can save it for the end, or ask now. Now's your time, but we're gonna get started in just a minute or two. Is everyone on?
Oh, then we can start now.
Yeah.
Everyone is here, so this is great. If you feel comfortable, you can turn your camera on. That always helps me present a little bit better because then I feel like I'm presenting to someone. So that's kind of good if you have the opportunity to do that. And then again, if you just keep yourself on mute unless you do have a question, and that way you can unmute yourself and we don't get any feedback. So I think most of you were referrals from BDMs throughout the country. Maybe some people found this through Instagram or our website. But what tells me that you are at the level that you need to be at is your referral, because typically reps around the country will think of accounts that just have kind of already been nailing Botox, but want to add a little bit more to their repertoire. And that's what I feel like MicroTox and NasalTox is. It's really my answer to almost every solution I need. Any problem, I use this as a solution. I'll give you an example. Someone who feels like who had their forehead done maybe with traditional Botox and then comes back maybe feeling a little bit heavy. They're not heavy. The photos show that they're not heavy, but it's a feeling that they get. I like to just offer them a couple of units just right out here to kind of pop up that lateral lid, and they feel like the world is just all better when we do that. So it's sort of my solution to a lot of issues. Sometimes when people have crepiness under here, I'll use that as a solution. And then there are things that you can treat with MicroTox that you can't treat with traditional Botox. So this is just going to give you a whole world of opportunities that you haven't really been able to experience yet. So I'm going to go ahead and advance the slides here. And let's talk about MicroTox and its origin. So MicroTox is a trademark term, as you know. I own that. Here's my registration mark. We actually defend this quite regularly because a lot of people don't realize that it is a registered trademark term. And so they throw it around just like they would use any other term, like baby Botox or I don't know what other terms it's used for, micro Botox, microtoxin. Those are not trademarked, but MicroTox is. And so whenever we see that on Instagram or online, or when I hear it from a conference, my ears kind of perk up because they're not allowed to use that term unless we've given them permission to use that term. And the only way that you get permission to use the term MicroTox is by taking this course. So I encourage you guys, as you do your postings, to post the word MicroTox with the R that's circled. And if you're typing that on the computer for a Mac, I know it's Option R. If you're typing it in on your phone, it's under the emoji section, kind of near the numbers, like the 1 and the 2. There's some symbols out there, and that is where it's found. So it's pretty easy to find on your phone even as well. That way, it tells your patients that this is something different from regular traditional Botox. Their eyes are going to be opened, no pun intended, that there is something different than regular Botox. And it's a differentiator for you. You've taken this course, you've spent the time, you've spent the money to become licensed in this. So this is something that's going to set you apart. So I would definitely encourage using that registration mark. Otherwise, it just looks like you kind of made up your own little technique, and it really doesn't have any substance. I did publish about this, and I put an article. It was a very brief publication, but back in 2013. I guess I just like to mention that because it seems like a lot of people are doing versions of this nowadays, and I think the version that I'm teaching you is going to be different from what they're doing, but it is something that has quite a long history, that I have been doing it since 2013. All right, now, what are we targeting with MicroTox? We are targeting the superficial fibers of the platysma on the neck, and also the superficial erector pili muscle. So basically that muscle, I don't know if you remember learning about this, but it's the same muscle that when you get cold and you get the goosebumps, like your skin comes away from your body and it looks kind of wrinkly and a little bit raised and not quite as smooth as you want it to be. So by relaxing that muscle, the opposite happens, just like when we tox any other areas in the body, the opposite of the physiology of the muscle happens. So it will actually compress into the skin. So we're targeting it in a couple of different ways, but particularly around the eyes and on the face, we're specifically targeting the erector pili muscle. This is a smooth muscle. So theoretically, you get to see an instant effect, and I still haven't figured out if it's because it's a smooth muscle that it happens instantly, or because it's so superficial, the process of the uptake of the toxin happens a lot quicker. I haven't quite done that detailed study on it. But one way or another, you're seeing effects pretty much when they leave. You can kind of see the effects. And that's why I like using it for a lot of like troubleshooting too. It's like, oh, let me see if I can get that a little higher, and it happens instantly. So that's kind of nice. Now, just to give you some more background, there is a physician out in Singapore who coined a term similar. He calls it mesobotox or microbotox, and he describes this technique as chemo resurfacing. And I do kind of like that, because it is it's really a skin textural change treatment. And so that is something that he's described in publications and such. But in all of his publications, he's never talked about the instant effect of this. So something is different. I've never seen him inject. I've never seen his technique. I just know I've read some publications on it, but he's never commenting on how this happens instantly. So there's something happening differently with this technique versus other people around the world that are doing similar things. As far as reconstitution, it really depends on what you typically use. I usually say double what you normally use, but I use a 1-to-1 reconstitution. So if you're using a 2.5, which is on label, you would probably want to just stick with 2.5, because if you go much greater a dilution, there's a couple things. First of all, it's going to take you a lot longer to put in. You're going to have more pokes and more areas. And then secondly, there's the potential to spread into the deeper plane and actually affect some muscle movement, which is not the desired goal in most areas that we're treating. So just keep that in mind. Maybe stick with about 2-to-1 or 2.5, and you should be fine on that. Any questions on that, feel free to type that in. But basically, we talked about the erector pili muscle. It's a microscopic band of tiny smooth muscle that attaches to the hair follicle on one end and also on the tissue on the other. When contracted, this muscle's role is to elevate the skin tissue. However, when injected with your Botox, that smooth muscle responds immediately with a skin retractive effect, which is likened to a shrink wrap effect. So it contracts the skin and actually compresses the pores and the fine lines that you see kind of spread throughout the tissue. It compresses it. So it's a really good skin treatment as well. So that's something you can think of kind of all over the face. And here is a great example. And I left the timestamp on these pictures because I wanted to prove to you that they were taken, the pictures were taken about 45 minutes apart, not even, let's see, 45, 15, yeah, about 45 minutes apart, I guess. And you can see she had kind of all over her face, and you can see some little dots still around her eyes, but we did the lifting here on the side of her face and the corners of the mouth and some of the horizontal lines across her face. And you can really just see her, look at the shape of her face. So it's really kind of heavy down on the lower jawline. And then now it's more triangular. So you can see that instant effect. Okay, I have someone registering. Hang on one second. I'm gonna let this person in. Not yet, but let me know when it comes through. Okay, so so this is an overall general, and of course with Botox and aesthetics, you know, it's specific to the patient, but people need to have some parameters. I understand that. So general areas of using the MicroTox and kind of what it will do for you. And by the way, we intend on sending you handouts from today. So you will get this, you can take it and put it in your cabinet if you need to refer to that. And we're going to send you your certificate as well. So those will be coming in the mail this week. Well, we'll mail them off this week. You'll probably get them next week. But anyway, so let's go through each area. So you can basically do it anywhere in the entire face to give that overall glow. So if you look at like the frown line area, it's not going to replace Botox in the muscle. You still have to do intramuscular Botox there, but it will tighten the neighboring area. So if you have those etched lines that don't go away with your intramuscular Botox, you know, those patients that frown and there's no movement, but there's still a line there, you can actually tighten that line with MicroTox and it really looks nice. And it will help with some of that ruddy texture there and some of the pores that are there as well. These three that are kind of inside here, this works really well for a medial brow lift. So if you're trying to pull the entire brow up, you would want to do these three kind of right in here, 3 or 4, and you can use 3 or 4 units there to lift up that medial brow. And then it goes kind of onwards. We've got the periocular area, kind of the lateral lift here, the lateral canthal lines, again, not necessarily for crow's feet, but for tightening and smoothing of the area so that it looks like it's been resurfaced. And then you can kind of come all the way under the eyes. Now I gave you the unit range here between 1 and 3. The higher you get, the more complications you get, and we'll talk about a few of those complications. But those are some ranges here. And of course, if there's 2 of them, it'll say per side. And then moving on to kind of this whole cheek region here, you can do all of the cheek area. I got her, she's in. Welcome. So you can do that whole face lifting technique here with the Botox, kind of in the MicroTox area, all the way up in here in the face. And that is typically between, I don't know, 15 to 20 units per side. And so those are in small little tiny aliquots throughout the face. And then we have the perioral. So for the lipstick lines, we're not necessarily doing lip flip with it. This is really just for texture. Remember, think texture. So if someone has those ingrained lines, you've tried filler, you've tried the lip flip and they just have so many wrinkles around their mouth, this is really a great treatment for them. And then of course, moving on to the chin where you're smoothing that area, and it's not necessarily going to stop the movement, but it does help tighten the skin. So after years of movement, they get those etched in lines, and that's what it's for. And then of course, the neck, which is probably going to be your #1 area of use in the neck. And that is where you're going to spend the majority of your time, I think, with most of your patients. Great question. How long does it last? Thank you, Shay. Good to see you. So MicroTox is the same as regular Botox, traditional Botox. It will last as long as the units you put in. Pretty much. So if you are dosing with higher dose, like the neck, for example, gets 30 to 40 to 50, sometimes even 60 units, that's going to cost you a good 3 to 4 months. Some of the areas we're not using as much, say that upper lip, you're doing 3 or 4 units. You're not going to get as long as you would if you were putting in a full dose, but you can't get to the point of where you would want it to last 3 to 4 months, because that would probably be about 20 units up there. And not that they would be able to feel it because it is intradermal, but that's just a lot of units for someone who may not want to pay for that. We're going to talk about who's a good candidate for sure. Pretty much anyone can do this. There are only a couple of not good candidates and only in a couple of areas. So we'll talk about that. I have a complications slide we'll go over. And then lastly, in this picture on this slide, I've introduced you to kind of the nasal tox. So that's a different, it's the same technique as far as MicroTox, but it's a combination of intradermal and intramuscular for nasal slimming. And we'll go over that as well. Yeah, so the neck, it's going to be injecting very superficial, not even in regard to horizontal lines. So this will help those horizontal necklace lines to disappear, but we're not actually, that's not our goal. We're not kind of going on either side of it. We're just treating the entire area, blanketing. All right, so let's watch a video and then you guys can ask a few more questions.
And we'll be injecting in the very superficial muscles of the face here, not affecting any of the deeper muscles. It's going to affect any movement. So we're just actually targeting the tissue here, the pores, the texturing, and a little bit of tightening. It'll give her kind of a shrink wrap look. We're gonna give her a nice lift. It'll probably look like this when we're done. We're going to be working on the laxity on the lid here and tightening up a little bit of this crepiness all around the eye as well as underneath the eye to tighten up the tissues under there. We'll also be working on the corner of the mouth, a little bit in here in the chin, just elevating that tissue, tightening it up, relaxing that superficial portion of the muscle. I'm gonna do 7 on one side and 7 on the other. And I'm going to come up in here, very superficial, just under the tissue. You can see the depth there is extremely superficial, epidermal. So I'm going to come up even more superficial. Just under the skin. Micro aliquots. So I have 15 units here for this side and 15 units for the other side. And this is a 2-to-1 dilution. I suggest doing double what you're used to. If you're used to a 1-to-1, do 2-to-1. If you do 2-to-1, do 4-to-1. You want a little bit of dispersion here. This has been shown to help with facial flushing as well as sebum production, acne. And you can see the blanching, and that is an intended response. It's what we're actually looking for. It's a good placement. And it's super important on the face to make sure that you're in the extreme superficial depth where you're going to affect their smile muscles. You can already see the elevation of the tissue just from that. There seems to be an instant effect of this neuromodulator in this depth. Coming out of pore.
That will happen.
You're just going to suspend the tissue as you go.
Really important to hold that tissue tight to get
Getting a little
the
bit
depth
of
you wanna
retrograde
go.
threading as I'm coming out to try and evenly disperse it as much as possible. So for those secondary smile lines out here, this works great. You can also do filler, and they're used in conjunction. This in no way replaces filler. It's in conjunction with. Now, as you come a little bit below the mandible, you have the freedom to go a little bit deeper and hit some platysma at the same time. And this is combining the MicroTox with the Nefertiti lift. Okay, so that's the face. I'm going to start in the midline. You see the depth here. Platysma, which is an intended response for tightening. You can see the little wheels. There is this instant feel that they already see a difference that day, but I say it will continue to get better for the next 2 weeks. Right.
So you can see the
Okay.
little
Yeah,
blebs.
can see
You
it.
can see some of the dots and you can really see how that's lifted. Look at her lip, her corner, her whole face, her neck, that left eye, her left eyebrow. It's a really nice dramatic change. And that is obviously when we just finished. And so it's still a little bit swollen. Okay, let me just bring Botox to, okay. All right, so any questions after watching the video? You guys had great questions in the chat box. Someone asked if they were 1-unit blebs. You're gonna get to the point where you're not really looking at the amounts. You just know you have 15 or 20 units to kind of fill in this whole area. And at that point, you just kind of spread them evenly. And so you're not really looking like regular Botox. You're like, I want 4 units here, I want 2 units. It's just more like a bleb. But about 1/4 to 1/2 a unit per spot would make most sense, about a centimeter apart. Those are just general rules. It's definitely going to lift the lid. In fact, that's kind of why we do it around the eye. It will open up the eye and it will tighten that crepey skin. All right. The question most people have after watching the video is, as far as timing, is it going to take a little more time? And the answer is yes, more than likely it will take a little more time than your traditional Botox. Do you charge more for it? It's really up to you. A lot of people have like a procedural fee for it, either $50. Again, it is very exclusive. Not everybody's doing this. It's going to offer your patients things that you can't offer without it. And it makes sense that you would do a procedure fee. My thought process, because I kind of developed it in-house and added it on, and I just didn't want to say, oh, now I'm charging for it. I just thought, this is on top of your traditional Botox. So my Botox numbers are no longer in the 40s or 50s. They're usually in the 70s, 80s, 90s, over 100. And so I kind of feel like I'm making more money because we're doing more units. When you do a small amount of units, you don't really make a lot of money. So this way it kind of pushes those units a little bit higher. Daniela asked this great question for this particular patient here. How many units were used for the eyebrow? Was that for this picture or for the video? But either way, I tend to use, depending on my patient's age and the amount of laxity, between 18 and 22 units around the eyes to kind of get, okay, so on the video, actually, Daniela, the patient I'm going to be doing, one of the 2 patients I'm today is going to be back. She's the same one from the video. And I was just looking over her Botox records and she gets 24 on one eye and about 22 on the other. So that's what we do for her. And of course, it's dosed based on the number of laxity. And yes, you should do conventional Botox in the same day as your MicroTox. And so you need to make sure the patient understands that some of it they will see today, the MicroTox portion, and some of it they'll see in about a week, which is going to be your traditional Botox. So we just kind of say it just keeps getting better and better, because that way they're not expecting everything to kick in on the same day. So this particular patient here, I like to keep the pictures close so you can see the changes. You can see where this lid, can you guys see my cursor here as I'm gliding that across the screen? Are you able to see that? I'm looking to my people on video. Okay, good. Yes. So you see where this lid margin is over here, where it's kind of hanging over her lash. And on this side, you see the lid margin. She's got a good 4 or 5 millimeters here on this side. So that's a big change. This piece of fabric is not as drapey as over here, and this line has been repositioned to here. These are instantly, you can see the little poke marks, and so the black and white is helpful because you kind of can focus on the lift and not necessarily the dots. But those are instantly, and you can see also the shape of her eye is much larger in the after. And this is another one that we did. We did the glabella area. So I have her frowning in the before and frowning in the after, and these were about 30 minutes apart. So we didn't do her traditional glabella. We just did MicroTox here and MicroTox around her eyes to make the eyes bigger and also to lift the brows. And you can see the shape of her eye is much larger afterwards, and she's hesitant with her frowning in the after, even though we did not do traditional Botox. something to think about for certain patients. May want that in addition or in lieu of too. This patient wasn't particularly concerned with her frown. She just wanted a brow lift. Here's another combination treatment. So lower face arc derma, which is my patented dermal filler lifting technique. But on the upper face, you can see her beautiful lift on these lids and the size of the eye. Look at the amount of scleros show on the corner here versus here. And if we were to measure, you could see a huge change on that opening. And then more importantly, though, to the patient is that lid laxity, this kind of ballooning that's happening out here. And you can see how that has definitely changed. And then even out here, you see these fine lines coming down here, which are her crow's feet are much softer. And this is all instantly the day it was treated. And so a close-up view of like how many injection points you're going to be doing. You can see how many. There's just 50, probably 50 spots on each eye. So this brings me to my point of numbing. So you may not be used to numbing for Botox, but we do numb for Botox because I'd say, well, probably unless we're not doing the eyes, I'd say almost 100% of the time, we're combining your conventional and your superficial at the same time. So, oops, we got Cheryl back in the room, it looks like. Cheryl got kicked out. We got her back in. So I put this here because you may want to consider numbing for it. It's also a little more uncomfortable in the superficial plane. There are more nerves there. So we just want everyone to be as comfortable as possible when doing their treatment. And so we find that numbing really does help accelerate our speed and also make it much more comfortable for the patient. So this is a sample of how many pokes you might actually have among the patient, but you can see a really nice change. It looks like she's been airbrushed over here on the right. And so when you use it on the neck, just what the difference here. So this type of, the worse the neck is, the better the results are. Actually, it's easier to see results when they're really sun damaged and have a lot of textural changes that are, due to sun. And so this is a really nice softening in the after here. And here's a front view. So you can see the depth of all of these coming in here. And these are a dime a dozen. I mean, I do these all day long. So these pictures get, we could have hundreds of these going on, but won't bore you too much. This is my favorite neck to do though, that very high sun damage, lots of leathery kind of skin going all different directions. The wrinkles are going all different directions. And so this is after it's healed. Most of my pictures are kind of instant because that is a little bit impressive. But with this picture, this was 2 weeks later. So that's completely healed. Typically around the neck, I'm using anywhere between 30 and 50 units. It can't affect swallowing because we're not going deep enough. So you really could do as many as you wanted there. There's no kind of upper limit on that. But financially, most patients are comfortable, around the $300 to $500 mark, depending on how much their neck bothers them. But the more you do, the better it works. And here's another eye. And you can see I love this picture of the draping. So a good question, Yael, when you take neck pictures, do you have them looking up or straight ahead? Well, however you do it in the beginning, you have to, of course, do it at the end. These are done straight ahead like this. If they're too hyperextended here on the neck, you're not going to get that effect. So they should be level with the floor. So the chin should be parallel to the floor. So you get to see some laxity, but not too far down where you're seeing all kinds of laxity. But again, it's all about the before and after. If you want to get a really good before and after, you could have their chin down, take it kind of from the bottom, but then you would need to do the after that way too. So do a couple different views and see what works better for you. So this is that draping around the eye, and you can kind of see this billowing. And I like this because the freckle kind of is a good reference. See where it sits here and where it is there. So if we're looking at eyebrow lifting or eyelid lifting, this is a great way to measure it. Now, let's talk about who isn't a good candidate. So people who aren't good candidates, or people that you need to be more careful with, they might choose to still do treatment because they like the results, but they're going to be pretty swollen. It's going to be people with very high propensity for swelling under the eyes. So you need to ask them about this stuff. Do you have a morning swelling? Are you kind of puffy in the morning when you are dehydrated, or cry the night before? Are you swollen in the morning? These are risk factors. If the answer is yes to those, either don't treat them or treat them with the expectation that they're going to have some initial swelling. It could last a couple of weeks. I've heard anywhere up to a month, honestly, with some patients around the just with my colleagues. And so we want to mitigate that as much as possible. I'm a huge believer in antihistamines. If you haven't heard me lecture on this before, I'll say it again. Anytime you do anything around the eye, whether it's filler or Botox, I really like people to take daily antihistamines. Over-the-counter allergy pill is really helpful for this. You can also teach the patient how to do their own lymphatic massage, because what's happening, even with traditional Botox, this can happen, is you slow down the lymphatic system as well, and that, gets rid of fluid. So if we're slowing it down even more because we're going right on top of it, we need to teach them how to mimic their own. So doing that medial to lateral massage and then all the way down to the neck, and have them do that with either a jade roller or a frozen tea bag, caffeinated tea bag, or even just some eye serum with like a stainless steel roller or something to kind of get that movement out and about. Does everybody do that already with their Botox, or have you seen that help? Anyone doing that? Teaching the patients how to do their own lymphatic massage afterwards. The other thing you can do to kind of mitigate that is maybe come down on the number of units so that you are not hitting them too heavy all at once, and then avoid it altogether. Those are things. But this type of swelling, you can see this was after a MicroTox treatment, and it went away, and she loved her treatment. And so she kind of chooses to do it. In fact, my model who's coming this afternoon, my mom always gets that. She always gets a little bit puffy afterwards. It's not to this extent. So I have her on allergy pills now, but we usually just try and time her Botox about 2 to 3 weeks before her any event or family reunion or anything, because she's been places before where her eyes get really swollen, and it's usually just, too soon after Botox. So the other non-good candidates are going to be people who have pre-existing lower sclerosis or ptosis in the lower eyelid. So they have that ectropion, we call it, where it's already kind of hanging down. You don't want to weaken that area anymore. And even though you're really superficial, that muscle is really superficial. So the potential to get into that muscle is there. So those are kind of my patients I don't go underneath the eyes for, but that doesn't mean I don't do out here. I still will treat here, but maybe avoid going under the eyes, where that could get a little bit more hanging or a little bit looser. All right, let's go ahead and transition a little bit over to the nasal tox. This is a little more complicated. We are dealing with now an intramuscular injection as well as an intradermal. So there are tons of dilators on the nose. You just need to know right where they are and how you can affect the shape of the nose and the width of the nose with proper injection areas. So this is also most often an instant result. The combination, though, is you're going to do intramuscular out on the nostrils or the nares here, where that dilator nares muscle is. You're going to do intramuscular. So they have to wait usually about a week for that. But the rest of the top of the nose is going to be intradermal, and they will see that right away. So it is one of those things. It's like, do I already see it looks better? And the answer is yes, but it will continue to get better in a couple of weeks. So this is just going to give you kind of the anatomical areas across the bridge of the nose, treating those dilator muscles. There's one compressor muscle that's kind of right on the tip of the nose in the center. Other than that, the rest of the area on the nose is kind of an area that will slim and lift the tip. So we just mark it out with our pencil where we want that to go down and get smaller, and we circle that, and then we inject in that area. Now, a little caveat on the nose, I prefer a 1-to-1 reconstitution with this. So let's talk about reconstitution real quick, because that question came up also in the lecture. When you have 100 units of Botox, what you reconstitute it with becomes your reconstitution strength. So For me, I have my 100 units of Botox and I put in 1.1, I draw up 1.1 cc's of saline, and then I put it into the bottle. So only 1 cc gets in there, which is why I pull up 1.1. And so I'm left with a 1-to-1 dilution. Any additional saline that we add to that, like if I add another 1.1, it's now a 2-to-1 reconstitution. So if I'm doing all MicroTox, I might mix an entire bottle with 2-to-1, 2 cc's to the 1. If I am doing combination, and Billy, did you pull up all that Botox? Just curious. Okay, maybe I'll show you, but you would want to pull up. Does anyone else use a 1-to-1? Just so I know who's using a 1-to-1, because you might want to pull up your 1-to-1, like around the eyes. You would pull up your 15 units of Botox out of the 1-to-1 bottle, then put your syringe in a bottle of saline and pull up another 15. And now you've made your own 2-to-1, but out of that 1-to-1 bottle. Does that make sense? So you don't have to have 2 bottles floating around. If you use just the 2.5, because you're on label and your standard reconstitution, you can use 2.5 pretty much everywhere. My only caution would be around the nose, and it's for 2 things. First of all, you don't want any migration into the levator muscle. So that's pulling up that lip, because you don't want to drop their upper lip. I prefer Botox only in the nose or anywhere in the lower face, to be honest. Not Dysport, because there is a little more spread with Dysport. So that's another kind of caveat. But the reason I like the 1-to-1 on the top of the nose and in the nostrils is this is probably one of the most painful areas you will inject. So the more pokes you have to put in that nose, the more uncomfortable it is for the patient. So not only do you have the migration factor into the levator muscle, but also the pain factor when you're injecting that in, and it's just a tight space. So the more fluid you try and fit into that tight space, the more uncomfortable it is for the patient. And we, of course, want to make everything as comfortable as possible for our patients. All right, so any questions on the nose? We're going to go on with some pictures, but if you have any questions, let me know. This is just another anatomical picture. So these are the dilators we're working on. The dilator naris anterior, and then there's a posterior one right here as well. We are also going to be teaching today the depressor septi muscle, which is right at the tip of the nose. And then we're working on the transverse nasalis as well, which is where we typically do bunny lines, but now we're using it to smoothen the skin. Lastly, here's where you don't want to hit, which is that levator labii superioris aliqui nasi, or the L-SAN muscle, which pulls up the top of the lip. You see, I'm using it right now. And that pulls that up. If you weaken it, and by the way, this has happened to me many times over the years with the nose, you'll get a drop on that unilateral side. And so then it looks real funny compared to the other side. So you kind of have to fix it on the other side. All right, so, but this is where these muscles look like here in cross section. All right, starting with the easiest one, that's the elevation of the tip. So we lovingly at the office call this the tip dip. So where the tip of the nose comes down when the patient is smiling on the side or even at rest. And so if that is happening for your patient, and I'm telling you, 75 to 85% of women have this, you can inject Botox right in the tip of the nose like this, anywhere between 4 and 10 units directly into that area. It's intramuscular, one shot, it's super easy. You can do that and it will elevate the tip of the nose for that patient. And you can see these before and afters. This is before Botox smiling, and this is after. You see that muscle's been weakened, and so the tip of the nose is straight. Now, this is a picture of my nose. I developed this technique actually for my nose. This was back in about 2006. I was looking at making my nose smaller. I didn't like the ball on the tip. A lot of different things. And I had tried filler in there, and it did help kind of elongate the nose and make it look a little bit more linear. But of course, that the more we know about that becomes a little bit riskier. And so I decided I only have 2 things in my toolbox. So I have Botox and I have filler. Let me try some Botox and see what happens. I tried it the first time without numbing, which was a big mistake because it definitely hurts. So I would definitely recommend numbing here. And I used to just do the flare to kind of narrow the sides there. And typically when you read about nasal flare, it's about the movement. Like when patients, you're talking to a patient and they have that kind of flaring going in and out, it's kind of distracting and they may want to come in. You can get that treated with 2 or 3 units. But that wasn't what I wanted. I didn't have that flare when I spoke. I just had a wide nose. And so I'm kind of these some is good, more is better kind of person. So anything that I read, maybe did 2 or 3 units, I was like, oh, let's do 10, let's do 12, whatever. And so I just kept going and my nose just kept getting smaller and smaller and narrower, which looked really great on the side. So I lived like that for a couple of years, but then I just really wanted the top to get narrow. So again, what do? You try it on yourself. You add a few units to the top and I have like a little bump on one side and that smoothing that right down as well. So it's almost like you're kind of shaving down highs with the Botox. It works really well. So anyway, you can that ghost image, which shows the before and the after. These are the 2 pictures layered on top of each other. And you can see that millimeters, probably 3 millimeters on each side distance that has come in afterwards. So I, by the way, will not live without this area. If you made me choose one area in my whole face to get Botox in, it would be my nose. And the picture on the upper left is the last known picture of me before Botox in my nose. And I'm wondering if it even was, or if it was just a washout period, because it still looks smaller than it normally did. But on the right is after Botox, and you can see how much more narrow it is. And then the measurements. So these are really hard to show on before and after images because it's just their millimeters. I mean, it makes all the difference to the patients, their confidence and everything like that. But in images, it's hard to tell. So I like these like circles because these circles are the same size. And when you put them on each picture, which is zoomed in the same, you can see where they've really narrowed in. And so technique wise, so for the side of the nose, I prefer just 1 injection point with your 10 to 15 units. So I have some patients that are totally fine with 12. I like 15 because the narrower, the better. But if you can get it in one shot, it's better because then you don't risk hitting that LSAN. If you have to do 2, you would come superior, kind of above that to do the second shot. And the reason you might not be able to get it in one is, first of all, it could come out of pore. So you're putting so much pressure in this tight space, it'll blanch. So you have to go slow because you don't want too much blanching there. You want that skin to accommodate to the liquid. And then it could just come out of pore. This particular patient you're looking at, if I keep going, her pores start cleaning out. So I get like oil shots coming out next to me. So I have to do a secondary one. So that's why I do the 2, and you can kind of see what that looks like. Same amount of units, just split into 1 or 2 shots. Hopefully that makes sense. This is straight in 90 degrees. You have an 8 millimeter needle. You're probably going to go in about 5 or 6. So probably not the whole length of that. You want to go through the other side. Just trying to get that muscle. Here's another picture here, smiling. You can see the flail that's coming across the nose here and the width, and then how much better that is. And these are patients that were like kind of scheduled for a nose job. And after this, they were able to forego that. That's how much of a difference it made for them. This is another ghost image overlay. You can see where the nose used to end here in the before picture and then where it is now. All right, so much more slim. Okay. And here's another ghost image right here. These are all different noses. Again, you got to get creative with your photography. So that's more like the width of the nares. Now we're talking about the intradermal tip of the nose areas. So for this particular patient, there's a little cleft in the middle of her nose and you can see a bump on either side. So you're tempted to put filler in there, right? But don't, because it's risky. So you can actually treat it with Botox and you're going to be injecting into the bump and kind of neighboring around it. So you'll circle the high points and inject around that. And that will smooth that right out. The other area she had was a nice bump on the bridge of her nose. So we circled that and also smoothed that out. You can see it's actually more apparent on animation, which is why she's frowning. Because she's frowning, you can see those bumps pick up a little bit more than when she's at rest. But she's frowning in both pictures, this intensity. And here she is smiling. You can see this little cleft here. this bump and also this bump and the tip here and where that's nice and smooth comparatively. And also this one, a nice big bump here. And yes, these are very superficial. This is your MicroTox, but used now on the nose. And the trademark term for this is nasal tox. And that is also a trademark term. And here's some side pictures here. You can see that bump, the height of that, and then these, the two here and how smooth that is. And a closer up view and smiling, again, you can see that. Some of these are just game changing. This area here, the tip of the nose coming down, you can see that. So she got the nostrils on the sides, the tip dip, which is the one we told you about earlier, right in here, and then the entire bulb of the nose treated with another 10 units or so. So there are a couple patients that I'm doing, 15, 15, and maybe another 15 here and maybe 5 up here. So we're looking at 50, 60 units just on the nose. And I'm telling you, get those kind of units in there and that nose is going to really transform as this one did. Even her nostril size is better. And you can see this here too. So the nostril size in frowning and just the opening here compared to here where that flare is not out and the opening is smaller. And then here she is at rest. Look at the flange here on this side of the nostrils versus right here where that's narrow. So it's pretty impressive. Last slide I just put in there is a underarm hyperhidrosis, and it's my reminder to tell you guys to practice with your underarm sweating because it's kind of the same technique. That's affecting the exocrine gland, which is decreasing sweating, and this will also decrease oil production in the face. It's going to reduce facial flushing as well in the face and make the face less red. So there are lots of other benefits besides just the wrinkles. You're going to get decreased redness and decreased oil production. So it's really good for acne as well. All right, my model is getting ready. Do we have any questions for today? Any other questions? What we have for you after today's course is a handout for your patients with 3 different befores and afters showing kind of the potentials of MicroTox. There's a little space for you on the bottom to put your name and your practice area right here. But I want to remind you guys that you all filled out non-disclosures, and these techniques that we have that I have patented and trademarked, I license them out to you. So I teach you how to do them. I show you how to do it. I give you the marketing. And then if you happen to leave the office that you were at or are at, that technique goes with you. So the office is no longer able to provide marketing for this because it belongs to you. We ask that you don't post this on Instagram as far as like the technique. You can talk about the fact that you do it, that you've been trained, that you've been licensed in this technique. But we don't like you to show the technique because obviously that kind of takes away your competitive advantage. This is exclusive, and you've licensed that out. So that's kind of the intellectual property talk I have for you. Any other questions about anything before we move on? And you guys can either unmute or type it in the chats.
Leslie, I have a quick question for you.
Yeah.
Microtoxing into the forehead, is that not like if somebody can't tolerate Botox, can you put a little bit of MicroTox into the forehead to try to help with some of those lines?
Yes, you can. I hesitate to teach on that. There is a doctor in Beverly Hills actually that has put out some sort of publication. I don't know that he has a trademark for it, but he specifically does it in the forehead. So I try and kind of leave that off of my presentation, but it can be done anywhere, especially for acne and redness in the forehead. You can do that. I would definitely not promise that they wouldn't be able to raise their eyebrows because that would be more intramuscular, but it will soften those lines as well. Does that answer your question?
Yeah. Every once in a while you have a patient who even 3 or 4 units of Botox gives them a brow ptosis or something at some level. So I was wondering if you can attempt to do a little bit of MicroTox just to help with some of those lines that are starting to become a little bit more prominent.
Yeah.
Okay.
So I would treat it just like you would the neck, kind of go in between and around all those areas.
Okay. Thank you.
Great. All right, so I am going to turn it over. Lauren's filming with another device here. I'm going to go with the patient, and then if I can have someone else just kind of monitoring the chat box. It might be more helpful though, if you guys have a question, to just unmute, and then I can.
Turn your.
You got it on? Got it on? If you have questions, go ahead and ask. I'm going to turn my microphone on. All right, better?
Should be good now.
Okay, so here's my model. Yeah, Billy's my model for everything. So question is, how do you guys sell this on top of regular Botox? So I guess anytime I do a consultation with a patient, it's always going to be symptom based. So I'll say something to the effect of, what are your goals today? Are you trying to lift your lids? Are you trying to tighten your under eye crepiness? Do these lines kind of on the side of your face bother you? And I'm throwing out symptoms. And if the answer is yes to that, I have the solution for those symptoms. So then I just tell them, in order to lift that lid here, in order to tighten up this area right here, I need, X amount of units, or it will cost you, $150 or whatever that number is. And that's kind of how I treat every treatment modality that I do, is I talk to them about symptoms and what they're concerned about and what that cost is. So if you're struggling selling even the 54 or the 64 units that you're doing on label, adding more units, we got to talk about how you guys are going to do that. They need to know what they're purchasing it for. Most people don't know you can do Botox in the neck. They just aren't aware of that. And so you're going to need to show them some before and afters of what that looks like. And you're going to say, if you want this in your neck, then, this is the cost for it. And kind of come up with that cost, I guess, is discussed based on the symptoms or outcome-based pricing. All right. So go ahead and rest your head, Billy. We have a few units here. You can kind of show that. We're treating her almost everywhere. I'm not doing her traditional frown because you guys know how to do that. I am going to do a little more traditional on the forehead because she's actually due for that area. So this will be more of your traditional, except I'm going to re-emphasize, because I know a lot of you have learned the line of convergence with me. I'm going to re-emphasize that with Billy. So go ahead and raise up your forehead for me so we can kind of see where that line of convergence is. It's actually where these two muscles come together and create this curve. So kind of right about there is what I'm guessing. I wonder if I have a ruler here still. I do.
I've seen it.
So many times.
Not class.
Sorry guys, I just thought about this. We weren't really training on the line of convergence, but I thought I would do it anyway. Oh well, that little miniature ruler. It's fine, you can kind of see it, but how you measure it is you measure from the brow to the hairline, and then whatever number this is, and if I can recall with Billy, because we have done this before, I think it's 6 centimeters. And so then we measure this 6 centimeters, and then we multiply that by 6, which is 36, move the decimal over, and then 3.6 centimeters from her brow is the upper line of convergence. So I'm just going to put some up there. I think we did 10, right? 10, so I need 10. Maybe a little differently. 2, 4, 6, 8, and 10 in the center. So this is more traditional. So sorry to throw you off, you guys, but she did need this. Raise up your forehead. So I'm going to treat 10 units here and 8 down below. You get a free bonus here. All right, so that was a 1-to-1 dilution of Botox, 10 units deep in the upper C line. In the lower C line, in this part here, we have 8+. So what I do for my foreheads, this is again, just kind of traditional Botox intramuscular, 2-to-1 in the forehead. So I have 8 units that I'm doing, but it's combined with double the saline. So now it's going to be 16 injection points of half a unit each. So raise that for me. We want to make sure we get her little commas here. 7, and maybe way over here, 8, and 1, and 2, and 3, 4, 5, 6, 7, and 8, concentrating kind of where the movement is most prominent. So these are half units, not quite as deep. So I'm going to go in at about 20 unit injection point here, or 20 degree. You could MicroTox this too, as I definitely had that question come in, and it makes sense you could. She just doesn't like her movement here, so we're going to take care of that today. Turn towards me. Really superficial at the tail of the brow here, half a unit only. Okay, perfect. All right. All right, let's start with the MicroTox. So what I want to show you is kind of where your go zones and your no-go zones. Everyone can see pretty well. And how is our chat box? Anyone can't see a chat box? Okay, well, you're going to have to unmute yourself and ask questions because we can't see the chat box from here. So as far as treatment zones, depending on the patient's age too, the older they are, the more you want to kind of stay away from the center area. Billy, I would consider her on the younger side. She doesn't have a lot of lid laxity. If it was down to here, I would be concerned of coming this high. Because she does have pretty good brow position, I'm going to show you where you can go. You can come in here, treat all the way around here. Go ahead and close your eye for me. I tend to sweep it over this way and then come back out that way again. So this is kind of all of this is anything after this, you could treat all of this out here. But for the eye area in itself, it's pretty much this section right here. All right, so I don't know what shape that is. It looks like a little Pac-Man. But that's what we do. So we have, for her, I just have 15 units. It's not too tautic. This is 10 right here. So I'm probably going to spend the 10 in here. About 3 or so out in here, and then probably another 2 under here. All right, so you can close your eyes and you did clean yourself, right? See the blebs and the depth here. I want you guys to notice how I'm holding the needle. If you get a close up of that. This is what I call a joint hold. You see I'm holding it with these 2 fingers, and then I'm just pressing with this finger down in here. You can press with anything, basically. It's such a small force. Anything can press that, but I'm using my pinky. Sure you can come on this side really quick to see my pinky. See that? You're right. So you can see the blebs. I forgot to look at your before to see if there's a difference between the 2 sides, and then I'm coming in here too. This is going to open up her eye. Remind me, is this your smaller eye or is your right? See close? Right there. You see that depth? Get in real close, Lauren. And you guys should be able to maximize your screen here. So you're seeing this as the large screen. And you can kind of change your settings in Zoom. So you're not doing the speaker view, but you're doing What view would this be?
Yeah, speaker view.
Oh, speaker view, I guess. All right. And I like to just kind of hold it open for a little bit. I don't know if it makes a difference, but I like to think it does. I have another 5 units here. And like I said, I'm going to do about 3 or 4 right here, not necessarily for crows, but it will help with crepiness. And then when I get to about 4 units on the syringe, which is really only 2 units, because remember, it's a 2-to-1 reconstitution. So these are half units for each line. I am going to move more towards the midline. Okay, look up for me. So now I'm just kind of focusing on this crepiness right in here. I have about 1.5 units left.
So is this separate from treating crows?
It is, yes. If someone wants true crows, you're gonna want to go intramuscular, deeper, right around in here. But honestly, I find that if you just lift the lids like this and tighten that, they don't mind a little bit of movement there. All right, close your eye. I'll take off this marker. Okay, look up. Just kind of like to tap it in. I don't know why. Just think it helps smooth it out and spreads it a little bit more.
Leslie, are you able to show us what half looks like on a needle or one?
Oh, half a unit?
Yeah, on that needle or
Sure.
with your reconstitution.
So with my reconstitution, you can see really closely, this would be 5 units in this syringe, but it's actually with my reconstitution, even though it says 5, it's only 2.5. So each little line is 1/4 of a unit, but each full line is half. So instead of this being 5, it's actually 2.5. So each one of these is half. Does that make sense?
Yeah, I think so.
Yeah, so remember, even though it says 10 here, there's only 5. It's half of whatever you pull up.
Uh-huh. Okay, thank you.
Okay, so we already kind of pulled up all the Botox, but maybe I'll do that for my next model. I'll pull up like a single amount and then I'll add the saline and then you'll see how it's just this, it's less in the area than it looks like. Okay, let me have you sit up really quick. I want to just see something. Okay, smile. Nice. Okay, so we're mostly focusing right here on that and the crepiness and the position of her brow, which is already quite elevated. If you just show the eyes. Look at how much lift it is. Can you guys see a difference between this eye, the way it flares up here versus the other eye? Okay.
I can.
All right, so the next position I'm going to go for is her lower cheek kind of crow area. Smile for me. See all this stuff right here? Between here and here is where her wrinkles are. And she has a little bit more right in here. So we could go for lifting, but I'm going to focus where these crows smile really wide. See how they keep coming down right here? So that's where I'm going. So we're going to see this get better just even today. Stretching the skin, picking it up like a tiny little sliver under there. You see the gray, you see a white bleb. You really cannot be too deep here or you're going to get in trouble with the smile. Like nice gray, oh, beautiful white bleb. Kind of picking her skin as if I was getting a nice little sliver out. And sometimes I like to get my fingers out of the way. We're so used to injecting like this, but that's going to force you to go too deep. If you just take your fingers and get them out of the way, you can get right parallel with the skin here.
How many units are you using for this?
So I have 15, I believe, pulled up for the face.
Per,
Uh,
area or
oh, I have 15 for this whole thing.
for the whole thing? Okay.
How many did you pull up for your whole face?
Yeah, what's the question?
Someone asked, can you show again how you mark out the eye for the brow?
Yep, we'll do the other side too. Okay, so that right there, I had 10 in here. I have about 2 left. So that was about 8 units. I'm gonna start working a little lower. And I will mark out the eye again.
What would be your maximum dosage in that area?
Probably 20 for the entire lower face. 20, even, I mean, there's no real max with this, you guys, because we're not hitting muscle. But
So what's the potential complication if you do too? I know if you go too deep, you can cause issues, but like
that's it. It's not going to be too much. It's going to be too
deep is the problem.
Is that Shay? I recognize the voice. Is it Shay or that was asking that?
No, it's Cheryl Sugar, but I have a cold, so.
Oh, okay, never mind. Yeah, so I don't think it's more about too much. It's more about too deep. And I have had that happen years where we've gone a little too deep and definitely had a little asymmetric smile, but not often. I think maybe twice in all the years of doing this, I've seen that. And then, you know, you just have to try and they either need to decide to live with it, or we can try to make the other side look even.
And you mostly, okay.
Pardon?
And you mostly, okay, are you mostly concentrating where you see the lines? That's the area where you're spreading it.
Right. So I circled those
Okay.
and I circled the majority of the wrinkles were here and here.
Mhm.
Remember? Now, if you wanted to lift the face, you can just do everything. You can start on this jawline. You can come up in here. If you wanted to work on pore size, you wouldn't really isolate it. This is her area of concern. So I'm kind of concentrating the wrinkle or the Botox in those wrinkles. Smile again. See how much better already?
So for the lift, for the jowl, you're going a little bit lower towards the,
Go a little
okay.
lower. Want to do like I did in the video.
Okay.
Kind of come
Would
across.
you do this for scarring, like for acne scarring on the cheeks? Would that help?
Yeah, for sure. Yeah, I love Botox for scarring. So you could come across here. You could come even in here. There's no kind of boundaries. It's just about depth. There's a little crepiness in here. So let me go in there. You in pain there. Smile again. See how much better these are. Really superficial here.
And this lasts on average 2 to 3 months.
Yeah, if you're like, if we use 15 units on it, probably gonna get 3. All right, and the hold. My hold compared to this. Even if you try and get superficial with this, it's so hard because all of this other stuff is in the way. You have to really go parallel to the skin. So think about the way you hold your syringe. All right. Let's do the chin area. Do half of that. And again, we're going to focus where her wrinkles are right here.
How many units are you putting in?
So the chin was
8.
8 plus, so it's going to be 4 units in each side. Does that make sense? So I have 8 units, so 4 units in each side. Which in the dilution I have, it's going to look like there's 8 units left in my syringe when I'm halfway, but it's not. It's just still 4. What were you going to ask?
And this is still 2 to 1 or 1 to 1?
2 to 1. So that's why, like,
Okay.
everything 2 to 1 with the exception of the nose.
Nose, okay.
Yeah. So it will look, like I said, like I have 8 units left in my syringe, but it's only 4 because it's doubled the dilution. Okay, so that's the 4 on that side. And you can see I have half of it left for the other side. And then what else were we doing here? Any fun things? Neck. All right, so we'll just trace that down halfway because I have 2 sections. Now you can come all the way down into here if you want. The main thing is to focus on where they're concerned. So So this is half of my stuff. So it says 30 on here, but does anyone want to tell me how many units are in here? If it's a 2-to-1 reconstitution, sorry.
15.
Yeah, so it's only 15. There's 30 here, but it's only 15 of Botox, another 15 of saline. So, and I have 2 of these because I have 30 total. So I'm going to do 15 here and I'm going to do 15 here. And I'm going to start at the top probably to kind of blend in first. Going to help her redness too. See, and I'm not really counting, but I am putting about half a unit in each spot. And you want to focus on where there are trouble areas. For her, it's like right over where I'm going. It's not down here. If they have a lot of drapiness down here, you definitely want to go down there.
You said you've used up to 60 units in a neck?
Yeah, I think I'm going to have another model come in. What I have you pull at 50. So we're going to do another neck that's a lot worse. Sorry, it's my mom. It's a lot more affected than Billy's. But for Billy, it's kind of right here is where her concentration is. Okay.
So if it was mixed by 2.5 for the face, not the nose, obviously, as long as we're half a unit on whatever we're used to, superficial white bleb, we're okay at the end of the day.
Yep, you're going to be fine. So
Okay.
2.5, you've got in 30 units, it's actually just 12. So you would be pulling up in 12, right? 12 unit increments if you use these syringes.
Right.
But I would recommend that you do because you're going to get a lot of dripping with the others. Okay, go ahead and sit up. I think we're halfway. Chin, neck, face, eye. All right, let's see here. Do you feel like there's a difference? We have our new mirror. Feel your eye. Oh yeah, look at the corner of your mouth too.
It's turned up instead of down.
And smile for those wrinkles are gone.
And they're not, are there?
Oh yeah, that separation of your face is a little more prominent on the
And the creepiness under my eye.
Oh yeah, that's good too. You getting a close up on that? Are you? Really turn towards this a little bit. Smile.
Do they tend to bruise a lot with this technique?
Yeah, there's a little more of this superficial kind of red dot bruises right around her eye. I would say this is kind of probably one of your number one complaints. People will be like, oh, I bruised last time. They're not dark ones. So this is going to be the darkest one she gets, that little guy right there. They're usually just red tiny dots. They're gone in a day and a half and pretty easy to cover.
Very easy.
But the alternative is don't use this technique on them. So when I have patients who complain about that, I'm like, okay, no problem. I can go back to traditional, but you're not going to get that lift. You're not going to get the eye opening. You're not going to get that mess. So you kind of decide what you'd rather. Okay, so just want to make sure you can remember she had that little crepey line up here. Smile big for me again. So that's so much better. And where that brow is landing. Can you get that from your angle? Sorry, maybe smile for me. See where this brow is up this way and that one's coming down. She even has a little like curve right there.
Yeah.
And then you said like the under and then these guys right here. And that chin, nice and smooth too. Good. Well, and in a couple of days, this will look great. All right, I'm gonna go ahead and measure her other eye and we'll get that done a little bit quicker and then I'll bring in another model and we're done.
Can you just talk slowly about how you're marking out the eye?
Yeah, so let's sit up for you. So the areas that I don't want to go, look straight, is I don't want to go, so lateral limbus is kind of halfway between lateral limbus and a lateral canthal line. And depending on their age, if they're older, I'm going to come a little bit farther out. Marking around here. Now you could go all the way out. There's nothing stopping you. The only kind of no-go zone is right in here. And that's where you're going to get a little lid ptosis, which you don't want, obviously. All right, here. coming around there. Smile for me. So where they stop, so they kind of come out to here. And then all the way under here. You can even come in here with some crepiness in there if you need to. There's kind of not an area you can't go except for right here. So you can see where
But you
did-
are doing the lateral part, like a little bit of the lateral part of the lid.
right here. Yep. Right here. That's what's opening up her eyes so much.
Mm.
Yeah. Smile again. So we have here and here. Right there. And then here and here is also a concentration for her. For that. And then we just, guys, look at that difference on the chin. It's just getting better. It just gets better and better in the minutes that go by. If you look at the crepiness there. Looks good. And then we'll finish with the neck. Okay, so I'm going to be a little bit faster over here. We have one more model that just came in. And all right, so we'll start with this. This part I did, so this is 10 units and I did it for the brow lift basically and right in here in the lateral lid. Turn towards me a little bit, Billy. Do you want to come over here, maybe? It's kind of nice. There you go. All right, so here's the area that you guys are all afraid to do. We're gonna come right in here, open that up and go, close your eyes. Go right in that corner, but see how superficial I am? Perfect. More. All right. Turn. Now I'm working on some crow's superficially and her under eye crepiness. For the first time ever, yesterday, we had a patient come in that had done under eye crepiness on, who said that she felt like she had really dry eyes, like really itchy, not dry, but itchy. And I'd never heard that before. We have been very windy here. I think she had a little bit of allergy flare up, but her eyes were, I'm not even joking, double the size what they were when she came in. So I think there was just more eye exposed to the wind and she was feeling it. So that was the first time ever. So that's kind of one other watch out, but I've never really heard that before. Smile for me. Okay, so we're going to target right here. So look at these crepies right there beforehand. Relax. Blebs, blebs, blebs. Nice little wheels. Look at that. The only time injecting you want to see a blanch like that. Okay, so that was about, let's see, 5 left. It was 10, it was about 5 units. Smile again. It's already getting better. Nice little squirt there. Sometimes it does come out the pores. You should be careful to. I actually started wearing glasses when I started doing this first of all, it helps me see because it's really finite, but it also protects your eyes in case it squirts back at you. Smile for me. Do that. So it's almost used a little bit like filler. You look for the laxity and you go there. So I'm just putting in quarter to half units in each of these little, if you get bogged down in like counting it, it's going to take you too long. You're going to be like, oh, it's not worth my time. So you just have to look at the wheel and then do your nice little massage out, integrate it in, and spread it out even more. Okay, I'm going to do the other side of the chin. Focusing on where she's most affected here. You all right?
Tickle
A tickle?
on my nose.
Oh, I was like, okay, best patient ever. She says it tickles. Okay, that's the chin. You get really fast at this once you know what you're doing and you're not too worried about units and depth and all that. All right, I'm gonna finish up with the neck.
The screen went dark. I can't see anything.
Is everyone else having the same issue? Let me know if you do.
It
I'm
only
looking at-
happens when people speak to me. When people speak, then it goes dark.
I think you're in the, are you in the speaker view?
Try
Yes.
changing different view options.
What other option do we want them to have?
If you just click Leslie's window, like where the video is, there's an option to pin. And if you hit pin, when other people speak, it won't change your screen out. It'll just keep her video going.
Thank
Okay.
you.
You're welcome.
All right. Now I am done with Billy, but what I wanted to show you guys is I do like to end with a really nice growth factor serum for many reasons. First of all, I do think it helps spread the toxin a little bit evenly. You know, I try to do that with the gauze wipe, but if you have a nice growth factor serum, it just feels really good. Secondly, you have all these holes that are still open and you're basically giving her a free microneedling treatment and you want to put some nice actives. You absorb 800% more drug when you have a pathway like this hole to get in. And so I tend to be in love with the ZO growth factor serum, but the TNS growth factor is really nice as well. We alternate back and forth between those two. I like this part.
I was just gonna say, I think you missed a spot.
It is super important though to send your patients out feeling like, they got some special treatment. Obviously the treatment is more about the needles and the drug, but if you send them out that this is the last feel and you do this, then they just kind of feel like they were pampered and it just gives more value to it. Like my little kitten here. All right, go ahead and sit up.
Thank you.
Okay, I'm gonna try and finish the neck here in 5 minutes while you guys ask me more questions. Do we have that?
Mhm.
Okay, good.
I will grab it for you.
Okay, how do you feel?
Okay.
Some patients say that they actually can
I feel
feel
lifted.
lifted and their eyes are open. They're like, oh, I feel like it's, is it my imagination or can I see better? Like it's really a big difference. Thank you.
It needs to be cleaned.
Yeah. So model number 2, hello. Yeah. We're going to be treating her neck, but also probably her eyes if you guys want to hang out with me. a little longer, but I wanted to show you more of the neck goes a little bit more towards the clavicle. So I wanted to show you a little bit different neck. And then if you want to hang out a little extra time, I'll do her eyes as well. Any questions? Okay.
Are you just putting this in BD needles?
Yes. Yes, they're easier to handle. You could definitely use your regular low waist syringes. The BD ones are going to be a lot easier to kind of control the flow and do quicker, I think. You also, okay. Nice. Go ahead and sit up for us. Let's take a look at your before. And we're going to mark out her area of concern. Now you could essentially do the entire neck all the way back on it. Most women though want to pay for what they
Wait.
see.
Sorry, we're back. We had a call come through.
Oh, we're back. Most women want to pay for what they see. And where do they look the most? They look the most right here. Oh, sorry, I just got pencil.
Hello.
Do a different one. So I generally concentrate it in the areas that they're most concerned with, which is right here. Now, she would probably benefit from doing her bands as well. We're not teaching that in this class, but you will see that the bands get better because the skin is going to be more like this. So you're going to see that get better, but I'm going to cover this entire area here. I have 50 units, so a lot more units.
How far laterally would you go? Like if she had more crepiness, would you go even more laterally?
You could come over here. You could do all of it. It's just cost. If they have all the money in the world, definitely go over here. But most people are interested in the center the most. But yeah, there's no
using 50 units on her neck right now.
I'm going to do 50 on her neck in here and here. So I'm separating it into quadrants here. 25 in the upper and 25 in the lower. Okay, go ahead and leave it. Sorry, my belly's touching. All right, so mostly gonna kind of try and work on that band, just getting that suppressed into the skin.
Momentum as well as into the neck.
Yeah. Just to kind of try and bury that band a little bit. So I'm not treating the band though, because it's too superficial for that, but I'm just trying to soften the skin around it.
Would you treat the bands and the MicroTox on the same day?
Absolutely, yep. You'd probably want to do the band first because the MicroTox is going to help a little bit with it and you'll lose a bit of your field of vision if it's already into it. All right, so tiny bit of this one in here. And so this is a lot easier to move that needle through. It can almost do the whole thing and kind of thread it. You get a little more surface area. This was definitely her more affected side. You okay?
Can you do this for the upper lip, like the smoker lines? Some people who have really deep smoker lines. I think you said yes before.
Yeah, you'll see that on the diagram that we send you.
Mhm.
Anywhere between 4 and 10, 12, 15 units, somewhere in there.
But you still want to do it with the filler, you said, right? You want to combine both.
And what if someone's totally against filler? They just want to do Botox for everything. You certainly can. It's just not as cost effective, because the filler lasts a little bit longer.
Mhm.
So, probably weren't numb that low, huh? Okay.
That's bad. Just surprised me.
Mm-hmm.
Okay, so we're halfway done with the neck. You can see it can be done pretty quickly. Let's see, I want to set that in a minute though, to let it set. Go ahead and sit up for me. Okay, looks straight. Smile. All right, so this is her more affected eye as far as the hooding and the smallness. I'm gonna go ahead and start on that. So if I can make this eye match to that side, we have succeeded, because that's what she's hoping for. But I'm hoping that it will actually end up being a little bit bigger. So this is kind of a big risk here at this point on camera, just for my own yeah, the right eye. Okay. Go ahead and lay back. And then just check them back for me one time again. So for this, go ahead and open your eyes for me. So this is that patient I said we have to be a little more careful with how medial we go, because she has a bit more of that laxity here. So we have here, come out a little and then back into that lid. You definitely want to get in that corner to open it up. Okay, and then I'm gonna actually do some in here too to open up this portion of the eye, because that's gonna lift this part up. And with that and that, it should look really nice. Smile for me. Good, relax.
Are you going to increase the amount of units that you're using for her because she's got more laxity?
Yep, so she's actually, I think we have 24 for this eye, right?
And that's for both the lateral and sort of under the eye area?
I don't know that I'm gonna do under the eye because of her, she's got a little bit of lid laxity, little lag here. She also gets pretty swollen under there. So I'm gonna more lateral to that. All right, and she is numb, but how you doing here? You all right?
Yep.
So these are in segments of 8, right? Or 4. 8. Okay, so that was 8 for her lid lift. I'll come and do about 4 over here. Sorry, I don't know that we numbed you here. So sorry. This makes them kind of feel like they want to sneeze. So sorry, Mom.
Okay.
Oh. Hate injecting family on camera. I feel so bad. Okay. And then I have another 8 for her, right? I love having Billy in the room because I get so focused on like the results. I need someone to tell me like, oh, you only have 1 more, or you have 2 more. And I'm like, oh, good, I can keep going. So it's just one less thing to think about.
Billy's Leslie's medical assistant, if she didn't see that.
Yeah, I don't know that I did introduce. I just figure everyone knows Billy's famous everywhere I go. True. Okay. Smile for me. So the last 8 units are just going to be kind of crows down in here. Relax. We'll give this a couple seconds to kick in. We'll check out the neck and then we'll check out the eye. It's going to take probably 5 to 10 minutes to kind of start working. Smile. Much better already. Perfect. And then if you want to hold that up for me, go ahead and sit up for me real quick.
Really wasn't bad.
Wasn't. Oh yeah, look at that brow already and that lid. Oh my goodness, that's nice and high. That she doesn't even have any droop on the edges anymore. And this is starting to kind of kick in a little bit. You can see compared to this side, you see all that draping over here she doesn't have compared to this side. Band definitely needs to be treated, but that's intramuscular. But other than that, that looks really great. You can see right where we did not go.
Someone asked about our numbing cream. It is compounded and then
Yeah, we have a, I think 4 ingredients in it. Here it is. We have a 23% lidocaine, a 10% prilocaine, and a 0.5% phenylephrine in an aquaphor base. Oh, wow, it's definitely bigger. I'm so excited. My magic trick worked. This is your small eye
Oh,
that's more closed.
yeah. Mhm.
Look at how much bigger and lifted it is here.
Yeah, definitely. Might
Well,
not
don't
have to
lift
use
it. Yeah.
that.
I'm just saying where it is normally in position. And then just go ahead and smile for me. So these are much softer too, right in here.
Mhm.
This poor girl doesn't usually smile because she said her eyes disappear. So when we do her Botox,
Aw.
I know, when we do her Botox, it's for eye opening. It's not the crow's. Like, she doesn't even care about the crow's. And most people don't. So if you just talk about eye opening, it's so much better. Okay, I'll finish the neck. 5 minutes over. I guess it's good for you guys to see how quickly this can be done, because when you first start doing it, you're going to probably take a long time and you're going to go, I don't know if this is worth it for me. But remember, it goes quicker. And how many more do I have for the neck here? One more so for here. It goes quicker the faster or the better you feel and the more comfortable you feel. And then also, if you're only doing, 30, 40, 50 units, you're not making a whole lot of money. Hate to say that. Botox is not as lucrative as everyone thinks it is. So if you can start adding on this neck treatment, some nose stuff, plus the regular Botox. Sorry, Mom.
Everyone complains about neck laxity.
Oh, yeah. So ways that you can talk to your patients, besides having your before and after pictures, of course, in the waiting room, when you're numbing them, because now you're going to start numbing, you can actually use that as a sales kind of tool. You can say, oh, I'm going to go ahead and numb for your Botox. Do you want me to numb anything around your neck? And they're going to go, what do you mean? We never, we've been doing a lot of Botox in the neck. If you think of something you want to do to kind of tighten up some of that crepey, I could go ahead and numb that for you today. And you're introducing a new area without saying, oh, have you thought about doing your neck? Like, you should get that neck done. That, of course, is not going to go over well. Yes, thank you. Oh, I should read my mind. Okay, let's map out this eye. Go ahead and sit up for us real quick, and let's continue to look at the differences real quick. See a big difference here, starting to open up. And relax for me, your eye. Wow. Bring it down. All right, so we're gonna go here, into the corner there, and around. Now, if I go too high, you can see she's pulling, that's frontalis. I don't wanna hit frontalis. Smile for me. Good. Perfect. All right. You can lay back. Last minute questions, guys. I'm going to be finished here in about 4 minutes. So this is your opportunity to ask me questions.
Given that this is opening their eyes so much, is this your go-to like brow lift treatment, or do you do any other technique pearls that you have?
This is pretty much it. If I want to add a little more, I can do intramuscular in here as well. And then, of course, glabella, the corrugators, will open that up quite nicely as well. So I kind of have to open this up with my fingers, look for vascularity, try to go away from the eye if you can. And the way I'm accommodating for her asymmetry in the eyes, because this was her smaller eye, more ptotic, is units. So it's not really placement, it's more units. This side got 24, and I believe this one was 18. That was a big
Our training materials from you, will there be more information about the dilution?
So the dilution, yeah, I mean, I guess it just depends on what you use. I'm happy to share what I use, but it's not going to really be relevant to what you use if you use something different. What reconstitution are you doing normally?
I'm just doing on label right now.
Doing it.
But if you feel like you're getting better results from the 2-to-1, I want to do that. I think I'm just stressing in my head more than anything about the concentration and inside of the needle.
Yeah, so I'm done, Billy, if you want to put her serum on her for me and I'll just chat with him. The main reason we use these insulin syringes is because it's 1-to-1. So when it's 1-to-1, you pull up exactly how many units you want. So let's say I said, oh, I'm gonna do 15 units around her eyes, not 2-to-1, just straight 1-to-1. I would pull up 15 units out of the insulin or out of the Botox bottle. That would be 15 units right here. But if I wanted to make this a 2-to-1, I would take the 15 units of Botox, I would stick it in the bottle of saline, and I would pull up another 15 units of saline. And now it says 30, but there's still only 15 in there. So that's how I make it 2-to-1. So that way I have the variability. So when I'm doing noses or lower face, kind of any of the, like the bands, I would do 1-to-1, the DAO, I would do 1-to-1, the Nefertiti 1-to-1, all of those areas, I have that ability to do the 1-to-1. And then if I want to spread it a little bit more, I pull up extra saline. So then it's 2-to-1.
Do you ever use your 100-unit vial and just put the 2.1 in for everything?
If I know let's say I know I'm going to do all MicroTox, neck and eyes. So say if they're getting maybe 50 or 60 in the neck and I'm doing 20 in each eye, that'd be 100 units. And I know it's all MicroTox, sure, I would pull up 2.1 and then just pull it all out that way, which is a lot faster than dipping and re-pulling.
Right.
Yeah. Most often though, I'm mixing it with like we did on Billy's forehead, the deeper, and then I'm adding here. So I just like the one kind of concentration and then I can always add to it. But your reconstitution is what depends on how many units are in here. So not to confuse you, but every syringe has its problems. This one is in units, but that only works for you if you do 100 in 1 cc in 100. If you don't, if you do the 2.5, you can still use this, but instead of 30, it's only 12. It's gonna be 12 units with your 2.5, which is fine. Let's say you wanted to do 12 around the eyes, you would pull up 30 and you would just do this and it would still be 12. So it really depends on how you want to do your practice and what everybody else is doing. We personally like one bottle with one dilution so that we're not kind of mixing it up. What if you do a 2-to-1 and then you only use 90 of it because the patient like taps out for pain or something, and now you're stuck with this 2-to-1 and you got to make sure you write on there 2-to-1 so that the next person who grabs the bottle doesn't think it's a 1-to-1, but now it's diluted half, double. So, but great questions on dilution. So 2.5 would work pretty much for everything you're doing. It would still work for the nose. It's just going to hurt a little bit more and potentially migrate, but I wouldn't even worry about that. I would just, if you want to stick with 2.5, go for it. There's nothing wrong with it.
For the marking you do for the eyebrow,
Mhm.
is there a specific landmark you use? Because some patients do microblading and the shape of their eyebrow changes and all that.
Temporal crest, like the edge of the temporal crest is kind of right here. So that's where I start typically, but there's really no problem coming in here. So if you look at the lateral limbus, go ahead and open up your eyes, Mom. So where the edge of the iris is and all of that white. So you can draw a line up there and then a line from the lateral canthal. If you need a landmark, draw a line from there and a line from lateral canthal and then do a line in the middle. And that's going to be, the line in the middle is going to be your most medial injection point. So let me get the blue real quick. So I'm going to go straight from her iris up and from her lateral canthus up. And then in the middle of that, and that's exactly where I kind of ended, all the way down, go ahead and close your eye, is all pretty darn safe right there. So anything from here, and I think I did most of that right there. So edge of the eye, iris, lateral canthus, do halfway, do a line down, and then anything in here is fine. It's this area right in here that's a little bit risky. Okay.
Would you be able to use that blue pencil on her nose and just go over your points of injection?
Well, it's going to be different for every person, but absolutely. So let's say she didn't like this tiny little circle right here. That's, I don't know if you can see it, that little protuberance right there. There's another teeny one right here. And this is actually really good after a rhinoplasty too, you know, as you age, the nose, kind of the skin thins and the ligaments change. And so you might get little bumps and stuff that happen after rhinoplasty. I'm not saying she's had one, but, and this would be a good treatment for it. So for her, I would stick, unless she was concerned about the nostril flare, I would stick in these little points here, these high points. And then you would just inject, let me just grab a little mock needle. It just can be blank. Yeah. So you would just come in through here and inject this superficial right in these points. Probably for this, I would say maybe 15 units. So this is a bit higher, so maybe 3, 6, 9, and then the rest in this high point right there.
Okay, and then I had a patient who her nose is just very enlarged symmetrically in general, and she wanted filler in her nose. And I talked to her about like the contraindications and just the size of her nose. It wasn't a symmetry issue. So would this MicroTox help her? You would just have to kind of inject all throughout the nose, just avoiding the levator muscles, obviously.
Take your pencil and like outline the area of enlargement. And can I draw on you? I want to inject, have Billy do it, or hold the camera. And that's your area that you treat. Yeah. So Lauren gets her nose done. She doesn't when she's pregnant, because that's not a good thing. But what she doesn't like is just this bump right here. So I just slim that right there. I kind of inject right in here. I think we do about 12 units right there to slim that down. If your patient was wider on the side, you could mark here and do a little bit there and a little bit here. Just know wherever you inject, it's going to get smaller. We have a really good case of a gal that took MicroTox in Australia that did it on rhinophyma. Oh my gosh, it was a woman. It looked like a man, but it was like she had surgery. Like it was like totally pared down, and the pores were smaller, and it was less red, and it just really looked great. So it just depends on where you want that to get slimmer.
Can you also just quickly show what you do for the droopy tip of the nose?
It's super easy. It's right here. You're just going to come in with your needle. Don't worry, Mom, I won't inject you. You've got, say, 4 units. That would be 4, maybe 8. You're just going to pinch and go straight in and push the whole thing in one.
On the bottom?
Yeah,
Not
right.
the tip of the nose?
Nope, right here.
Oh, wow. Okay. Perfect. And just the whole thing goes there. Okay.
You're going in the full length of the needle?
All the way to the hub. Yep. So here to the hub, push all your drug in one shot. That's to take care of the depressor thigh muscle right at the base of the nose. If you had a ptotic tip, even more so, you could do the tip like I just pointed out with the circles here. You could do that. Unfortunately, no one here really has like a ptotic nose. So yeah. So
I have one more quick question, if you don't mind. Can we go back to the line of convergence you were talking about on the forehead and your calculations for how many units you put above and below?
So the calculations for above and below, that's a personal preference. The calculations I showed you was about like where that line is, and that's the measurement that the ruler, well, when we measured. And so the amount you do above and below is definitely going to be patient specific. My only personal thing that I like to do is more on the above and less on the below. So what proportion that is really a formula per se. It's generally going to be like 10 and 8 or 12 and 8 or 10 and 6 or 8 and 4. So it's going to vary based on the patient and what the goals are. But the general idea is just to do a little bit more above the line than below.
And and tell me again what your calculation is. It's the
how to measure for it.
The measurement from the brow to the hairline.
Yeah. So you measure from the most natural position of the brow. You wouldn't want to measure from this high point because that's going to give you a false measurement. So you wouldn't want to go from this low point. So kind of go halfway in between. So you would take your ruler. Let's say this is a ruler. I actually wasn't planning on teaching this. I'm so sorry. I don't have my ruler with me, but you go kind of from that position up to the hairline, whatever number that is. Let's say that was 7. Okay, because it looks like it could be 7 centimeters. Then 7 times 6, 6 times 7 is 42. So at 4.2 centimeters, so that's probably what, 3, this would probably be more like 4. At 4.2 centimeters, you're going to make a mark. And then you're going to check it. Raise up your forehead for me. And you totally can see this. Actually, hers is a lot lower. I don't have a rule in front of me, but it's right here. And see how this is coming down and this is going up, and it that nice little relax. Up again. See? This is coming down and that's going up. You see it. It's so clear. That's down and this is up. And where that line is the line of convergence. And it will more than likely, Billy's going to get me a ruler, I think. More than likely, it'll be at 4.2 centimeters or whatever 60% of 7 is. There she is. So relax for me. Let's do it. Just relax. So 7, boy, am I good. 4.2 right here. Look at that. 7 centimeters from her brow to her hairline. From here to here is 7 centimeters. 6 times 7 is 42. So 4.2 is right here. And that's exactly where her line of convergence is. So you want to double check it. Watch for the animation as she raises up forehead for me. That comes down, this goes up, and then double check it with a measurement. And if you
And
want
what patient you see you do the line of convergence with.
yeah.
Okay.
Yeah, and then if you want to err on the side of caution, go with the higher line because you're not going to go wrong too high as below. Does that help?
Yep, great. Thank you so much.
So nice when it's that visible. Okay, you guys, well, thanks for logging in and taking time out of your schedules. Hopefully we'll send you a survey afterwards, but we've heard in the past that from everybody when we've done these webinars that it was a sufficient amount of video didactic to feel comfortable tomorrow. So hopefully you do, and hopefully you start doing it tomorrow with your patients and have lots of success. So we'll send you off your certificates and a little manual as well.
Thank you so much.
Thank you so much. Good night.
Thank you.
Thank
Good night.
you.
Thank you very much. Have a good night.
You're welcome. Gotta get line of convergence.
Are we offline now? Are we offline?